Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video reply to a question that someone posted on one of my other videos. And the gist of the question was the individual in question had been diagnosed with Lyme disease about 12 years ago, had different symptoms, and then had COVID about, I think, 15 months ago, and developed an exacerbation of a lot of those symptoms. And I don't have the question up in front of me. I don't have my computer handy, and I can't bring it up on my phone while I'm recording a video, it turns out, or if I can, I don't know how to. And so the gist of it, though, is like some severe anxiety, fatigue, brain fog, maybe pain. I can't recall off the top of my head, but basically just feeling a lot worse since having had COVID. And so the question was around, what can be done about long haul COVID and that type of thing. So just as per usual with any of my videos, nothing I say should be construed as medical advice in any way, shape, or form. Please talk to your personal health authority prior to making any decisions about your own healthcare. And at the end of the day, the COVID question or COVID related questions are a little bit of a bit of a gray zone because there's still so much that we don't know about the long haul effects from COVID. So what I can say is that in other cases, when a patient has come into contact with some type of a virus, that's like a non-COVID virus. Maybe it's HHV6 virus, maybe HHV8, maybe it's Epstein-Barr virus, also known as HHV4. Maybe it's the herpes virus, could be HSV1 or 2. All these HHVs, they can ultimately lead to a flaring up or a triggering of a person's immune system and sort of discombobulate or further discombobulate an immune system that's already having a hard time. So what I mean by that is if a person has persistent borreliosis, also known as chronic Lyme disease, Bartonellosis, babesiosis, mycoplasmosis, one of the big strategies or primary strategies that those microbes use to help evade the immune system and persist for so long is that they create an immune system imbalance where they put a patient into more of a Th2 dominance in terms of their immune system balance. And that basically means that it creates a whole bunch of unproductive inflammation instead of letting the immune system kill off microorganisms more effectively. So it's a brilliant strategy. If I wanted to persist in a human body and I could convince the immune system to not kill me and just create a bunch of inflammation so the person's defenses were even weaker, like it's a brilliant strategy. And so when there's already that backdrop, then when something's added into the mix that further pushes that immune system dysregulation by increasing inflammation significantly or activating the inflammasome as it's called, so kind of all these different cytokines that ultimately are cell signaling molecules that or immune system signaling molecules that tell the immune system to be in a more inflamed mode, that can really pour gasoline on the fires that have already been set by those other microorganisms. So that's a little bit of a background in terms of why that might happen with a certain type of virus. I can't necessarily say I can't say definitively that that's something that would happen with long haul COVID, but clinically in the patients that I've seen who have had COVID and they have persisting symptoms, it definitely plays out like that. In terms of what to do about it, the things that I found to be the most successful in my practice with my patients when they have some type of a viral trigger that exacerbates these underlying immune system dysregulations is working with things that are immunomodulating and anti-inflammatory, and those are not quite synonyms, but there's a lot of overlap there. So some of the things that have been really helpful in my patient population have been things like quercetin. Intravenous ozone therapy is really helpful for patients who are if for patients who are able to access it if they live close enough and are able to do that. Low-dose immunotherapy can be very helpful as an immunomodulator in general. Chinese skullcap and Japanese knotweed are good immunomodulating herbs. There's others as well. Red sage, red root, kudzu are certain immunomodulating herbs. Making sure that a patient's vitamin D status is adequate, because vitamin D is really important in immunomodulation. And then other things that have more of an anti-inflammatory effect are sometimes helpful. Sometimes curcumin, sometimes frankincense extract, and there's various other things that can be helpful too. But that's kind of the way that I conceptualize it with my patients, where I'm thinking, okay, there's this over sort of this exacerbation of this inflammatory state. There's this exacerbation of this Th2 dominance, and so I really want to immunomodulate and reduce inflammation to get things on track. A winning strategy in those cases, in my experience, hasn't been using strong antivirals, and I think the reason is that whatever viral issue was the trigger for them, it's already been dealt with, or it's not, there's not a ton of viral replication happening. It's kind of done its damage, and then it's just sort of left or gone back into dormancy or gone back into remission. And so it's really more of that anti-inflammatory immunomodulating combination of things. So great question. It's a huge topic. If there's further questions about this topic or anything else, just post them in the comment section below, and I hope that this was helpful.